We got the Stayplate and a digital impression in the lab, and we are going to be taking out tube number 24, and let's see how it's going to fit. Tube here with mobility. Can you open for me? This one is moving. So we're going to be very conservative how we take it out and put a bone graft in for him. I want to explain to you, can you hold this straight? I want to explain to you the reason that this tube is really become a problem is because you can see from this occlusal view, it rotates lingually. So the patient constantly hit on the tube, or maybe when it rotate back here lingually like this, it doesn't have any friend. So this tube keeps going up, if it's become very loose. If I can show you on the back here how the tube look like. So again, the same tube. I'm gonna just show you this same tube here. This is the one. So that one also on the back side, you can see how much bone right here. A lot of bone loss because of the tube is just going in, and so that's why bone loss and recession comes because of it grow inside. This is the one. Okay. So we need to understand that when you don't have a straight teeth, you have a problem. See the lot make the new denture that is parallel, is straight, make the tooth more perfect. That's what's supposed to be, straight situation, not rotate in the back. This is why we want patients to have braces when they were young. The earlier they have braces, the more stable the tooth. Before I numb the patient, but now I'm going to show you why the tube is hopeless. You can see that I put the instrument in, there is no more bone. Really deep, there is zero bone. So this is very unhealthy situation. And that's the reason why the tube is mobile and it's ready to come out. And so the way we do this is simply just, I'm going to use the aerial probe and just go around here to loosen the tube. And then we're going to pick up the forceps and take it out. Very simple process, but then we're going to wrap the tube with bone graft material to give the patient some bone later on, so in the future we can do an implant there. Ideally, I would love to do the implant on the same day. In this particular situation, I told patient, but he wanted to just delay the process of implant, so we're just going to do bone graft first. So here we go. I'm going to show you, okay, which is really easy. So I'm going to show you why they bone loss as well. So here you go. So you're going to zoom in and see how much the advanced periodontal disease with calculus. A lot of calculus. So that's why the bone is really detolerating because of bacteria infection. Curate. Yeah. We're going to make sure we remove all the infection. This one. We're going to go in and remove all the infection here. So at eye clean and also at I take out your tube, this tube, I saw that the facial aspect. Remember how the tube was lingually inclined, so it create either tube eruption this way. It open up the pocket, periodontal pockets, and then the calculus go in this way, and therefore now the facial aspect, there's an empty bone right here. So we have to preserve that facial aspect of the bone level to grow it back. So I'm cleaning up first really clean well. I'm checking all the walls. I see the defect buccal aspect.
Okay.
And also I see the defect very little on the lingo. So the predictability that we're gonna regrow this bone socket is pretty good. I'm going to clean again, make sure I clean everything first. Then I'm gonna irrigate this tube before I pack the bone, okay? So this is gonna go in. Very, very easy, simple procedure, but if you need to know how to clean the infection before you graft it. You also have to feel where the bone missing to. Like I mentioned to you, in this situation we don't have enough bone on the facial, but we do have bone on meso, distal, and lingo as well. So that's a good side. So there's only one wall defect. We're gonna graft this bone material, and we're gonna use there's over so many bone graft material out there. We are using the Particulate Maximus bone graft material today, and so we're going to go ahead and graft it. Okay, really fun process here. You will use the condenser for me if you have a condenser for me. Yeah, turn this way, please. So we're going to slowly pack it in. You can see that it going in very easily. Seems like the socket is dying to get the bone in. So take a look, you can see it's packing pretty well there. Use the condenser to go in a little bit more. So in this case, you can see I predict that I use the bone, but it looked like we are full, so I'm going to use one more bone material to fill up this part. I'm going to let my assistant know in just a minute here. We're going to use, or we're going to pack some more from this angle. Then plug in here at the way to encapsulate the socket. Now you can see it's very nicely filled up completely through the gum line here. Then I'm going to show you how it looks, because you really want to see how it look after the grafting. So that's how it look now, nicely and stabilized. I'm going to put the here, and I'm going to give the patient instruction to hold on to that. So you can see it's really nicely established. No suture needed. You just need to wear it a little bit long. So when you deliver a denture, you can see it's loose. We're gonna tie this up for him. Give me the. After tidying up, it look good. Patient feel comfortable. Thank you for watching.